In the last 2 decades or so, technological advances have started creeping into our branch. And
I have recently seen your patients, getting work or getting into their routine in the same day, in the tenure when they are in the hospital. Okay.
so we started with minimally invasive cardiac surgery, and that was a big thing about 10 years, 8 years back. You must realize that this has no boundaries. A
Yeah.
person sitting across the world in another continent can sort of, we can use his expertise anywhere in the world,
What is keyhole surgery?
because heart being a moving organ and with a lot of blood going across it, and it's very important that that circulation is maintained even when we are operating on the heart.
Right. What is that one factor or one habit you have to make yourself stress free? Namaskar, I am Sapna Golecha from CK Birla Hospital, Jaipur, and welcome to you for yet another podcast of HealthyYou. Today, we are going to talk about the latest advancement in cardiac surgery and what revolution it has got into the outcome of a patient treatment. Talk on this on a straight note. I have the distinguished guest, Dr. Alok Mathur. He is a distinguished cardiac surgeon and a director at CTVS Department at CK Birla Hospital, Jaipur. Sir's leadership quality, clinical expertise, and a commitment to excellence has got impact on number of lives and got smile in their life and their family. Apart from being just a cardiac surgeon, he is also a sports person, and that spirit and energy he gets into the OT room and ensures that the outcome is as good as what he has expected. So, without wasting time, I'll go straight to Sir. First of all, sir, thank you so much for your time on this podcast. So, I just want to ask the question that earlier years people used to get fear when they were talking about cardiac surgery, and today what we see is people rather than fear look for the choices what they can have in the latest advancement. So how has heart surgery changed in the past few years?
Well, thank you, Sapna, for having me over. And that's a very relevant question because we have seen this happen in front of our eyes when we started cardiac surgery practice. When I started practicing about 30 years back, then there was a lot of missed. And the reason was that the branch was still evolving.
Yeah.
And our patients, the mortalities were higher, and the morbidities and recovery times were very high.
Right.
In the last 2 decades or so, technological advances have started creeping into our branch, and technological advances assisting us both in the operating room and in the post-operative care. We have seen dramatic improvement in results of cardiac surgery, and they have helped patients get better and get better sooner. So and this spreads from word of mouth. Patients who get back sooner and have very little pain or trauma, and they can get back to their normal lives very quickly. This kind of word spreads in the society, and that's why now people realize that the best results in cardiac diseases till date are by cardiac surgical procedures. And so they come, and with the advent of new advances, now they have a lot of choices which we can offer them for even a faster recovery.
Sir, few years back when I had my uncle getting cardiac surgery, it used to take 15-20 days for him to recover. And I have recently seen your patients, getting work or getting into their routine in the same day, in the tenure when they are in the hospital. So, and we also hear about latest technology today is like AI and robotics. So, how do you think this has helped in the outcome of the patient?
Well, like I said, it's a continuous process of evolution. And the last few years have seen an explosion of technological advances. So much so that, people like me who are very interested in adapting these advances in our practice, I find it difficult to keep up with the advances. They are happening
Oh,
at such a fast rate. So from traditional cardiac surgery, and technology helped us get, people better. What we used to do on what we call a heart lung machine for bypass operation, we moved about 1.5 decades back. We moved to what we call beating heart surgery for bypass operations, and
okay.
we don't really stop the heart, and we are able to, with technological advances, do a safe procedure while the heart is still doing its
Still doing.
work. And so that was one advance which helped patient recover a little faster. Then technology has also refined in monitoring and experience building, and ICU care has also dramatically improved. And now we realize that the sooner the patient gets out of the hospital and back to his work, the faster the recovery is. And the heart, as is a very resilient organ, and it takes very little time to get back to physical activity. It likes physical activity, so we should give that. About the advances of robotics and artificial intelligence, for the past decade, maybe a little less, we have been actively trying to make the incisions and trauma to the patient smaller.
Okay.
So we started with minimally invasive cardiac surgery, and that was a big thing about 10 years, 8 years back. And we started doing small incision heart operations, and moving from the center bone cutting incision to a side of the chest incision where we enter the chest between the ribs and essentially don't cut bones. So it's less trauma to the patient, less pain, and definitely a much, much faster recovery back. Robotics has come in a couple of years. I at best it is evolving still, although in select patients it's been shown to be very safe. And essentially the hurdle is that the fine stitching that we do inside on the surface of the heart, the instruments are almost getting there. Not They are not quite up to where we would like them
Okay.
as a safety and compromise, but um, the changes and the advances are so rapid that it's only a matter of time. And the good thing about AI is that it is a constantly evolving scheme. So every procedure that happens all over the world contributes to new
Mm.
advances. If a surgeon faces some problems, then that helps the program learn faster.
Right.
And the other thing is a remote cardiac surgery, which is coming because you may not have the best of the experienced surgeon at every center. And so
Right.
a surgeon who is sitting at a remote area with the help of robotics and AI can assist this surgeon at finer aspects of cardiac surgery. So that's an exciting new field.
So I think, sir, what one advantage I feel what you said is from the remote areas, like people were not having access to technology is second thing, but access to doctors who are very clinically expert at that remote areas, but now can have access to those experts through remote areas. I think that is one of the good
Yeah,
revolution.
and we try to limit it to areas, but you must realize that this has no boundaries. A
Yeah.
person sitting across the world in another continent can sort of, we can use his expertise anywhere in the world, and it's really very hard to comprehend that cardiac surgery is being performed by a surgeon who is sitting, thousands of miles
Miles.
away, and safely being done and reproducible. And it's only a matter of time. We are right there. It's only a matter of short time where this will become a standard of care across the world.
So, though you have explained already what is minimal invasive surgery, there are few other terms also used for the same thing. I think so. People have heard or also searched what is keyhole surgery. So, if you could just elaborate bit in a more simple language so that a layman crowd could understand.
Sure. Traditionally, what keyhole surgery is a concept or a term that was coined for laparoscopic abdominal operations,
Okay.
because they don't really need to give an incision. They just insert two or three ports, and so port makes a small hole in the wall or the skin,
Right.
and so that was termed as a keyhole surgery by some vivid surgeon. In cardiac surgery, we are still at a stage in minimally invasive where we give a smaller incision, a couple of inches, maybe 3 inches, much smaller than what we used to give. And the reason is that our instrumentation is much more complex than general surgery instrumentation in
Right.
the abdomen. So we need it because heart being a moving organ, and with a lot of blood going across it, and it's very important that that circulation is maintained even when we are operating on the heart.
Right.
So we need a little bit of more paraphernalia. So robotic is going to get us to that level, but
Okay.
right now we are at a maybe a couple of inches, 3 inches. So technically, keyhole surgery is not a concept that has really settled in
Mm.
for cardiac surgery.
Okay.
We are getting there.
Sir, one question which I would like to ask you is heart problems at times does not give symptoms. So today Gen Z, if you say, they are looking for more of gadgets, if it is smart watches or something else, we are just going ahead, "Ki, okay, this will help me out," and lifestyle habits. So what do you think? How helpful are these kind of gadgets if we talk about heart problems?
I mean, yes, the gadgets can be used to monitor how your body is reacting to maybe exercise or daily stresses or things like that. From a clinician's point of view, they're not very useful to me
Okay,
because number one, they are not standardized.
okay,
I can trust, Apple claims they have the best gadget, Garmin says they have the best gadget. But for me, the sensitivity is not really to that level where I can trust it to make decisions about treatment or disease. The other thing is that Gen Z should be aware that what not to blindly trust what the gadget says.
right,
I mean, sometimes when you're sleeping, you will get an alarm that your heart rate is 140. It is a false alarm most of the times. But if you trust it completely and you start panicking, then your heart rate will actually go down
right.
to that level and cause more danger than benefit for that matter. But yes, if you use it wisely, it is a thing which has a potential of monitoring how your body reacts to exercise. However, if you have no symptoms during exercise, then you probably don't have any serious cardiac ailment.
Okay,
I mean, there are some risk factors which we like to keep a close eye on, like you have a strong family history, or you are a diabetic, or you are hypertensive, or you intake tobacco in any form, chewing or smoking. Those are the subsets of people that we would really like to monitor and not wait
ah,
for symptoms to come in.
symptom.
But as a general rule, if you are not getting any symptoms while doing physical exertion, you probably don't have a serious cardiac ailment.
So I think in a very simple way, sir has explained us कि if you are not having issues while doing a physical activity or feeling stressful, you are at a less risk of having a cardiac problem. Sir, one last question I think which Gen Z also would like to ask you is, if we talk about you, it's a complete combination of mind, body, and skill. So, and you work on in an OTs for hours together. So, what is that one factor or one habit you have to make yourself stress free?
Well, yeah, different people have different ways of dealing with stress. I think every one of us, when we interact in society and do our job, face some kind of stress, and over the period of years, when you been in the profession, especially healthcare, then you tend to realize that in the larger scheme of things, a person is not that important. We give too much importance to sometimes to ourselves and what
Right,
our actions are going to do. And I mean, they are important, and you are an essential part of the society, and your actions is. But sometimes we go overboard. We are so focused on ourselves
right,
that we think that if I don't do this, the world will come to an end. Well, it does not. I mean, the world moves on. So we should keep that, in my opinion, that perspective in mind, that we are in actually at the end of the day, we are an insignificant dot on an insignificant planet in a universe which doesn't even register our planet. So, just to keep not going overboard. I mean, of course, things that you are doing are very useful to society. They're important. You should do them well. But getting worked up on them is not going to help. If you're stressed up, it's not going to help you do it well.
right.
So that's what we keep in mind when we are doing a job, that yes, we need to do it well. But if I get worked up that if I don't do this, then my patient will probably die. If I keep thinking about all this,
Right.
then I will not be able to do a good job. So keeping that in perspective is how I deal with my day-to-day stress.
Thank you, sir, so much for this useful tip, especially for all of us that we should not overboard ourselves thinking that we need to be perfect all the time.
Correct.
Thank you so much, sir. And if you have any questions or anything related to CTVS surgery, you can always drop into or visit CK Birla Hospital RB at Jaipur, and you can take an appointment for Dr. Alok Mathur calling our call center 71777717. Thank you so much.